Hi, I'm Wesley Walker of the New York Jets, former All-Pro wide receiver. You're watching Bridge to Health at Madhousetv.com.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi again. Welcome back to the Bridge to Health. My name is Dr. Tom Dow, and each week we have a special guest on our show, which is part of our healthcare team to help you, the patient. Our offices in Melville, Ronkonkoma, and Hicksville are much different than most offices. In our offices, we have a team of professionals who work hand in hand on a daily basis to give you, the patient, the best care possible, kind of like a la carte. And if we don't have professionals in our offices that we need, we have a network of professionals we can just get on the phone with, speak to, and they can help us solve the problems of diagnosis and accurate, really good treatment. Today, we have a special guest, Dr. Salvatore Corso. Hi, Dr. Corso.
How are you?
Thank you for joining us today. Dr. Corso, by trade, you are an orthopedic surgeon, correct?
That's correct.
Okay, and you are now getting into kind of like the pain management realm at this point now, with what's been in the headlines all over the nation, medical marijuana, correct?
That's correct.
Okay, so let's talk a little bit about medical marijuana. Let's kind of like get rid of the myths and dispel some of the untruths about what medical marijuana is and what it isn't. So, when did you first find interest in medical marijuana as a treatment option to help your patients who have chronic pain?
Well, first of all, Tom, I do have a significant number of patients that suffer from chronic pain. It could be from arthritis, it can be from any type of neurologic issue, and it's a very common issue in my practice. I've had situations where I usually have to prescribe, even post-surgery, patients opioid-type treatment, including narcotics, Vicodin, OxyContin, oxycodone, and as you know, which you see in the paper quite often, it becomes a real issue, certainly from an addiction standpoint and certainly from a side effect standpoint with having to treat patients over a period of time. And certainly I do have chronic patients that I see with these problems. I did have the well-being of being associated with a physician who happens to be also a family friend, who's a GI doctor at North Shore Hospital, who got involved with one of the groups that was trying to obtain a licensure for distributing medical marijuana coming up. And as we know, January 1st of 2016 is when it will become legalized in New York. He asked me to be on the medical board of this particular company. As it turned out, this particular company did not get one of the licenses, although they are going to continue, I believe, to pursue that. But at the same time, the concern that we had was that there really is not a lot of research. Why? Because, as you had said, some of the myths, medical marijuana back in 1960, due to one of the acts of Congress, was considered a Schedule I drug and became illegal, mostly because of the recreational standpoint. And I want to make sure that I emphasize the fact that we're not here to advocate in any way the use of recreational marijuana. This is strictly through a medical use of the drug.
Right.
And as we're finding out with the amount of research, even though it's been limited because it's a Schedule I classification, and the any type of monetary use of it towards research and developing the types of regimens that should be used has been limited. So studies have been, and this is why it has become a myth. What we have found out is that there are over 60 types of chemicals within the marijuana plant, a lot of which ones that do not cause any psychotropic or high effects as what might be seen. And we've even seen it be effective in children when there is a higher dose of the CBD, and we'll talk about that,
Right.
content of the plant, and therefore, it's a very safe treatment, again, with more and more research.
Okay. So let's go back to myths, okay? When I grew up back in the 70s, my parents thought of marijuana users as killers, psychopaths, psychotic people whose minds aren't quite right. Whereas today, medical marijuana, they don't smoke medical marijuana, correct?
That's correct. There are patients that do, and that gets us to one of the real keys to the route of administration or the delivery system that's used.
So there will be medical marijuana smokable in New York or not?
I believe that it will be allowed to be smoked, but really the focus is going to be more on either the edible type or what's considered now much safer as far as inhalation. Inhalation is one of the ways, the traditional ways to smoke it. However, with that, there is some concerns. Concerns about its effect on the lungs, concerned about the carcinogens that are smoked with it.
Right.
There is now found to be what's called vaporization, or as you see with e-cigarettes,
right,
where the plant material is actually burned and vaporized without burning the carcinogenic type materials, including the benzenes, the carbon monoxide, and the tars that are found in the rest of the plant. So what is done is the vaporization works not only to minimize any effect or risk on the lung, and certainly any risk of cancer, although again that has not been associated with studies with regular marijuana smoking.
Right.
But not only the vaporization, what it brings out is the terpenes, which is another material or chemical within the plant, which has been shown to have an anti-inflammatory effect.
Really?
So it works not only to protect the lung from risks, but also protect the lung from inflammation.
Right. Okay, so we all know how dangerous opioids are now and how they're abused. Not by everyone, but certain people abuse them, then they get hooked on them. Then the next thing they know, they're doing other recreational drugs. Is this medical marijuana addictive?
There is certainly an addiction, or I want to say a dependency. But here's the difference. First of all, it is, as far as a side effect, one of the biggest things is there are no receptors, cannabinoid receptors, and one of our other guests will get into the endocannabinoid system, which is found in the human body. But there are no receptors in the brainstem, which controls respiration, as opposed to an opioid. So you can overdose and die from an opioid, from a respiratory seizure, or basically stopping breathing. It does not occur with medical marijuana. So really one of the biggest and most dangerous side effects really is not in play as far as that concerns.
So death and overdosing from respiratory arrest doesn't happen with medical marijuana?
Does not happen with that. Can occur, obviously, with opioid treatment.
Okay. So if somebody, once this all becomes legal and you as a doctor or other doctors start to prescribe this drug, which is going to help people with their chronic pain, can they drive when they're taking it? Does it affect their reflexes? Should they only take it at home when they're going to bed? Because I know certain narcotic medications, they recommend you don't operate machinery or drive because of how it affects your reflexes and things. Is this the same?
There's no doubt, as far as depending on the content, again, when we talk about extraction of the material from the plant, and we can get into that whole factor, but as far as if you're using a plant or a dosage that has a higher CBD content, there's two main ingredients that come out of the plant that are therapeutic. One is the THC. That has a psychotropic effect. In other words, it affects or connects to receptors in the brain, so it will affect certain things like coordination. It may increase your heart rate.
May give you the munchies too, right?
It can definitely do that. It can cause dizziness. But the truth is that there are a lot of treatments where the CBD aspect, which does not have any psychotropic effects, it does not make you high, but yet it is very effective in anti-inflammation, in treating muscle spasm, in treating spasticity in multiple sclerosis. So there are patients that have that regimen or that dosage.
And they're not going to get high. They'll be able to carry on life as normal.
They can take it during the day. They can work very well and do whatever they have to do. However, certainly any type of medication that has THC in it, you're going to have the same precautions as you would with a narcotic. You should not drive. You should not operate any heavy machinery. And there are some other precautions which we can talk about.
I saw an amazing documentary or video presentation. It was about a year ago, of a little girl who suffered from terrible seizures. She'd be walking along, and all of a sudden, boom, she'd fall down. It would happen like 10, 15 times a day. And they gave this girl medical marijuana, and it's like stopped her seizures. Is that what happens in real life?
Well, this is what's called Charlotte's Web, or this was named after a girl named Charlotte Figge, who's basically now about 9 years old. When she was 5, they were able, there was actually a Canadian named Simpson who was able to extract the oil from the plant, high CBD content, so there was no getting high from it. And he supposedly states that he was able to cure a skin cancer. The same type of extraction was given to this girl, Charlotte, who was having multiple daily seizures from a disease called Dravet syndrome. And she took 1 dose, and it reduced the number of childhood seizures. There was another girl, another one called Haley's Hope. Okay, this was, again, a mother who could not get treatment for medical marijuana. Her daughter was having up to 200 seizures a day, which I can only imagine the stress and the anxiety and what it was causing the family and the child as well. She moved to Colorado, started medical marijuana treatment with an oil with high CBD content, and she was able to get the seizures down. On a bad day now, she has 7 seizures. But most of the time, it's minimized to just a couple a day.
Wow, that is truly, truly incredible. And what a life changer that is for that family, huh?
Absolutely incredible. And that's where I think the focus going forward is going to be on this type of, especially for those types of situations. Childhood, where you have situations like this, where you can actually, in some cases, it's even been described as healing childhood cancer, certain types of cancers, that it is effective in slowing down the genetics of the particular cells that are causing the cancer in the person.
So you stated this also helps like muscle spasm and muscle spasticity. Is that true?
That's correct. As a matter of fact, there's now prescribed medication. There's something called Sesamet, which the generic name is Nabilone. Okay, it is a synthetically made marijuana. It is THC. That is specifically used for patients that have cancer, that are on a strict chemo regimen, and that have adverse side effects, including nausea, vomiting, loss of weight. Those patients are given anywhere from 1 to 2 milligrams prior, maybe 1 to 2 or 3 hours before chemo treatment, and it completely controls those side effects of the chemo. There is also what's called the Sativex, which is an oral mucosal spray. So it's only 1 spray. It can be given up to 12 times in a day as far as a dose, and it has been shown to be very effective against muscle spasticity in patients with multiple sclerosis, which is...
that was going to be my next question. For MS or any spastic diseases, has it been shown to help?
Tremendous. As well as, again, in chemo, patients with anorexia, losing weight, obviously it does affect the appetite in that way.
Wow.
There is something called dronabinol, okay, or Marinol, which is, the brand name, which is given to patients on a regular basis that are on chronic chemo, and it does, abate the side effects.
That is awesome. Now, on past shows, we've had other physicians here. We've talked about nutrition. We've talked about purity. We've talked about pharmaceutical grade nutrient products to make sure what's in it is in it. Let's talk now about how they get this medical marijuana oil or vapor. Is it derived from plants? Is it made in the lab? How pure is it? How do we obtain that?
Well, it's funny because the extraction process is relatively simple. Nowadays, they have these, huge machines which are called botanical oil extractors. You can put anywhere from 25 to 50 pounds of the plant material in it. It may produce 5 gallons of oil. And it's done without using any solvents, which can be used on a simple basis, if you use a solvent to draw the oil out of the plant. But it's just simply taking the plant, drying it out, compressing it, grinding it up, and then using a solvent and an evaporation process to obtain the oil. And I think, again, the oils and the waxes are going to be the materials that are really going to become very effective and are going to have the least side effects because, again, you're not going to have to inhale it.
Now, when you say oil, is that what they make the pills out of, the inside of the pills?
That's correct.
So there's oil inside the pills.
That's correct. They'll make capsules out of those. They'll also have topical oils and, again, waxes or certain materials that can be put into baked goods so that you can eat it.
Interesting. Let's talk now a little bit about dosing. You're a physician. You've got a patient with, on a scale of 0 to 10, 0 being no pain, 10 being the most severe. He's got an 8-level low back pain. It's been there for years. He's had 5 surgeries already. This is chronic. It's not getting any better. How do you, as a physician, know how to dose that patient? How much should he need?
There are some standard general principles that we may use, but here's the difficulty is that, of course, this is an atypical medical model. Why? Because it may depend on a lot of different variables. It may depend on the receptor structure, the number of receptors in a particular person's body, which would affect the metabolism of the particular cannabinoid that might be given to that patient. It may also be a factor of whether they had a prior exposure to the medication. The plant material, how strong is it? What type of strain is it? Again, when we get back to the research, when I've looked up and gone through my own literature search and read specific articles, there's no real standardization of treatment, okay? But there are some general principles. If you look at some of the professors, there's a gentleman named Don Abrams. He's a clinical professor of medicine at the University of California. He's done a lot of work and has treated patients with that have used medical marijuana. In going back to the traditional way, smoking, he talks about it pretty much being something where a patient who's a frequent user would be able to titrate or regulate his own dose, but always start with a small dose. So maybe they talk about using 1 puff at night and then taking anywhere up to Health Canada speaks about anywhere from 1 to 5 grams as a maximum of a day. That may be up to, 7 or 8, maybe 10 cigarettes, if you're talking about that. If you're talking about the dosing from the pharmaceutical products that we have now, it's 1 to 5 milligrams per kilogram per day for a particular individual. So there are, depending on the weight of the individual, and again, if you're talking about chronic pain, you're going to want a ratio of THC to cannabinoid of 1 to 1. So it is going to be something where that particular patient, you're going to have to give them the warnings. They may get a so-called high from it. They're going to have to take the precautions of no driving, and operating heavy machinery, things like that.
With opioid drugs, pain management doctors, traditionally they'll do urine tests on the patients to make sure that they are using the drugs that they're prescribing and they're not selling them somewhere else. Is that going to happen with this medical marijuana? Is it going to be urine testing to monitor the same way as if they're using it and they're producing it in the urine?
There's no doubt. The tetrahydrocannabinol, there are byproducts as well as the CBD that are found in the urine. It's easily cleared by the body, and that can certainly be monitored, and I think it will definitively be required by the New York State Department of Health as far as following up. Not only that, and that gets into our next venture, which is what we, in getting into this, we're really into the academic side of it. There's no doubt that physicians that will be looking to prescribe medical marijuana will, I believe it's already in law, that they will be required to take a CME course, specific number of hours, that will go over the entirety of the treatment of medical marijuana, certain protocols, the research that's been based. And we, as myself, Dr. Weisberg, who will be a guest as well, future guest, as well as Dr. Larry Good, we have formed what we believe is going to be a company that's going to get accreditation so that we can educate doctors about the treatment. And at the same time, we may have the ability to have algorithms at our hands, at our disposal, that will give us feedback.
Excellent.
And therefore may be able to look into some more research and be able to then forward that to the doctors that will be treating patients.
Interesting. I'd like to make it very clear to you in the audience that the whole purpose of our show, of the Bridge to Health, is to bring a team of professionals together to try to solve your healthcare problems as a team, give you the best treatment each profession has to offer to try to get you healthy. However, there are those class of patients that we've tried everything with. They've had surgeries. They have chronic pain. And these people have to have some quality of life. This treatment of medical marijuana, I feel, is probably going to be much more beneficial than the opioids we're currently using, which we already know what the effects and the addictive abilities of those are. But understand that health also involves life quality. If you're in chronic pain all day long and you can't go out and you can't enjoy your family, you can't enjoy your kids, there's no quality of life. You become depressed, you become anxious, your whole mental state dives. And if your mental state dives, your physical state follows. So understand, this is something which isn't for every patient. It's for those who have a quality of life and there's nothing really else to do. Is that pretty much true?
There's no doubt. As a matter of fact, there are a prerequisite list of disease states that are treated and that can be used for this particular medical treatment. So it's not going to be anyone that just feels like they want to go in and get some marijuana from a doctor. There will be questionnaires that have to be filled out. There are specific protocols that have to be followed, which you just touched on, which is going to be urine testing. There's going to be follow-up. And I believe that as far as, again, the dosaging, it's going to really be something that's restricted and followed on a very close basis as far as going forward with disease states. But there are, if you look into the literature, there is a widespread application of this medication to various treatments, again, including childhood epilepsy, childhood cancer, certainly Alzheimer's disease, HIV, cancer, multiple sclerosis. It decreases pressure in patients with glaucoma. There are just a litany of disease states. And again, probably not even the ones that will be allowed by New York State, at least in the initial phases. But again, this is a learning process.
Right,
and
right.
This is something that will continue to evolve over time.
So besides the anti-inflammatory effect, the pain control effect, and the munchies, are there any other side effects from medical marijuana?
There are side effects. They're found to be very mild. There are side effects. You do get tachycardia. You can get dizziness. It does have a short-term, an effect, on short-term memory, and it can also have effect on muscle coordination. And withdrawal symptoms from it are things like anxiety, shakiness, again, increased heart rate. You might have nightmares, you might have headaches. But these symptoms are usually within 1 to 2 days. They may maximize in anywhere from 2 to 5 or 6 days, and they may be gone within a week.
Any contraindications? Are there patients that you say you can't take medical marijuana?
Well, it's interesting because there really are no, from what I could see in the literature, there are no definitive contraindications. However, certainly anything with a high THC content is not seen to be beneficial in people under the age of 18. One of the biggest, although again, as we talked about, the high CBD to THC ratio is extremely effective in childhood epilepsy.
Right.
It is not recommended in pregnant women or breastfeeding women. Why? It readily crosses the placenta. It accumulates in breast milk. So it's been shown in these particular individuals. There's been some research that has shown that it will cause an increased risk of cancer in some of those children, low birth weight, possibly even an increase in leukemia.
What if they're taking other medications? Any kind of contraindications or side effects with other meds?
There are some things that have to be looked out for, certainly in patients that are taking opioids. It has been beneficial in lowering the amount of opioid that patient takes. So that's what's good about it, because why? It potentiates the effect. But if the dosages aren't worked out correctly, some of the patients that they've looked into have shown that there's a significant increase in the high and the duration of the high. It's not something, you can get a side effect as far as the lungs. So anyone with any type of respiratory disease, it can cause some chronic bronchitis. So anyone that has any type of cardiovascular disease, because it can increase the heart rate and lower the blood pressure in the acute phase, it's something to be concerned about. And also any patients that may have a history, a familiar history of some type of depression, schizophrenia, or even mania, it may bring out those symptoms in patients that really don't have those disease.
Thank you. Thank you very much. Could you let the audience know how to contact you at your office or an email address if they have any questions?
Sure. My office is in Woodbury. It's at 205 Frolic Farm Boulevard in Woodbury, New York. The office number is 516-364-0070. Call and leave a message. I'll be more than happy to get back to you. Again, not only for the possibility of treatment of medical cannabis in the future, but also for any type of orthopedic issues that you may have.
Dr. Corso, I want to thank you very much for joining us, and we will have you back again at a future date. For those of you watching us on Madhouse TV, stay tuned. We'll be right back. For those of you who are watching us on Cablevision Channel 20, remember one thing. If what you want is real wealth, join us next time on The Bridge to Health. If you're watching us on Madhouse TV, stand by. We'll be right back. If you're watching us on Cablevision, we'll see you next time.
Thanks for watching.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Dusty Walker of the New York Jets, former All-Pro wide receiver. You're watching Bridge to Health at Madhousetv.com.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi again. Welcome back to the Bridge to Health. My name is Dr. Tom Dow, and each week we have a special guest from the healthcare community who works with our team to help you, the patient. Our last show, our topic was medical marijuana. We're going to do part B of that show today with Dr. David Weisberg, Dr. Salvatore Corso. Welcome, docs.
Thank you.
Thanks for coming.
Thank you.
Dr. Corso, on our last show, we covered a lot of topics. We tried to dispel some of the myths and go over some of the truths about the real efficacy and the real advantages of medical marijuana in the right situations. Today, Dr. Weisberg, we're going to talk a little bit, you're going to help us talk a little bit about like kind of the biochemistry, what happens in the body when people use medical marijuana. So let's start off with, what is endocannabinoid system? What is the endocannabinoid system in the body?
Sure. So internally, we have a system that has been more and more detailed through research over the last 20 years. We have our own internal system that has receptors on our cells. These receptors on our cells have been traced back 600 million years in other plant species and other animal species to show that these receptors have existed for 600 million years. So suffice it to say, in the human body now, there are two main receptors that we know about, but there are probably multiple others that are part of this endocannabinoid system, CB1 and CB2. These receptors are receptors to chemicals that we have going in our body that act on these receptors to give specific effects. And these specific effects are effects that could have changes in terms of blood pressure, in terms of effects on inflammation, in terms of our immune system. It's manifold in terms of what these receptors can do. So the whole concept of medical marijuana is that plants have produced compounds that will go into the human body and react and attach to the receptors that are inside our body.
Where in the body? In the brain?
Okay, so suffice it to say, there's CB1, which is a receptor that is most aligned with THC, which is the psychoactive, psychotropic portion of marijuana, the CB1. That is mostly in the brain, central nervous system. Interestingly enough, it is not in the portion of the brain known as the medulla oblongata. And the most interesting part of that is people are always worried about overdoses. So typically people who overdose on the opioids, they overdose because in the medulla oblongata there are a lot of receptors for these opioids. It is the part of the brain that drives respiratory breathing. So if you now put too many opioids in, it goes to those receptors and people get respiratory depression and they can die. There is no receptors in the medulla oblongata for any of the medical marijuana components. So therefore you cannot have a overdose that would cause respiratory depression.
So when a person overdoses on an opioid or on heroin or whatever, they're dying because they're stopping to breathe, correct?
Yes.
And they have this drug now, which they want on all ambulances, that they give people who overdose that I think brings that breathing back. What is that called?
Naloxone.
Right. And
basically, it actually competes for that receptor. It knocks the opioid off. It goes on the receptor, so it no longer can function as a depressant.
It gets them start to breathe.
Yes, it gets them back breathing again, yes.
And medical marijuana doesn't affect those receptors?
It doesn't go anywhere near those receptors, but it does go near other receptors in the human brain to allow it to have some of the psychotropic effects. Now that's CB1. There's also a CB2 receptor, which is mostly found in our immune system, actually most concentrated in our spleen. And that's probably the one that's most responsible for a lot of the effects that we see that are the beneficial effects of medical marijuana. And I believe that Sal has discussed about the combinations of CB1 and CB2. It's not such a simple formula. And as we go on in this discussion, you're going to hear about how there are many compounds that all come together to give you an effect we call the entourage effect that medical marijuana affords you that is not necessarily afforded to you by the pharmaceutical compounds that try to mirror the medical marijuana compounds.
So the medical marijuana they synthesize in the lab.
Yes.
Is that as effective as a plant marijuana?
That's what we're talking about. So I do not believe it is, and there are many studies to show that when they use these synthesized compounds that are directly supposed to mimic just THC, just that compound, and they give that to one patient, and they give a dose of medical marijuana from a plant that has a high level of THC in it, they seem to have better effects with the medical marijuana. And the reason for that is that there are a combination of both CB1 and CB2 stimulants in medical marijuana. In addition to that, there is another set of compounds called terpenoids. And terpenoids are the probably 50,000 terpenoids that are plant extracts. And in the plants themselves, they act as herbicides, they act as insecticides, they act as plant hormones. There's many effects that it has for the plants. But when we ingest it into our cells, it turns out that many of these terpenoids have their own separate effects. They can have effects on anxiety, effects on nausea, effects on able to act against MRSA, which is one of the most dreaded infections in the human body. Well, they're finding out that some of these terpenoids can actually act against MRSA in the human body.
That's amazing.
So now you combine these terpenoids with these blends of marijuana. I know Dr. Corso talked about Charlotte's Web and talked about the high THC and the low THC blends. Well, that's now you're taking the medical marijuana and you're going to try to create a hybridization through plant genetic programming so you can come out with the exact plant with the exact set of compounds that you want. So we have CB1, which is the THC receptor, and we have CB2, which for the most part, cannabidiol, which is CBD. And CBD seems to have a tremendous amount of effects on these medical disease processes in the human body. But that is a oversimplification because there's probably 80 different cannabinoids that are out there, and they're all being studied.
We don't know about.
Right, and they're all being studied. And that's the difficulty we have here is that there are so many combinations and permutations that you have, and that's what we're trying to do with research, and hopefully there'll be more money for research in the future. Research has been mostly in Israel, historically speaking. They are way ahead of us in their medical marijuana research, but it is now coming to the States. I know Sal talked about an education program that Sal, myself, and Dr. Good are going to be having for physicians. We hope to raise the attention of the medical community to the issue. We hope to be able to bring money into the research realm of medical marijuana to make it a more valid and a more reproducible treatment.
So you gentlemen are actually going to be involved in setting up continuing ed programs for physicians to be able to learn more about this, learn how to dose, learn the indications, contraindications, learn how to monitor. Is that what we're talking about?
Absolutely. Sal?
And take away some of the myths that we had discussed earlier, therefore being able to get the money that's necessary for the research, and of course the feedback, which I think will all tie in so that we can then bring that information to the distributors and have them show them exactly the strains that are working on a particular disease process in a patient.
Right. I tell you, it just keeps sticking in my mind, that little girl falling 5, 6 times, 10 times in like 5 hours, and she does one dose and she's walking normally, playing like the rest of the kids. Those are the miracle things, but there are so many people out there who are just in such bad pain, and they've tried to cross the bridge and they've done everything possible, and there's nothing else left except the opioids, which we all know how dangerous they can be.
Yeah, Sal and I are both in the practices that do orthopedics. We see a tremendous number of pain patients, chronic pain patients, and unfortunately chronic pain patients that are addicted to opioids. We know the disaster that is.
Yep.
If we can help to find another avenue for these people to seek relief to their symptomatology, I think that would be the greatest thing that we could see in our practices in our time.
Right. What's the entourage effect?
So, getting back to the multiple different compounds, there's a feeling, and there's some research to support it, that as we talked about, there's a CB1 receptor, CB2 receptor, and then we have these terpenoids, these plant extracts. there's a feeling that by putting them all together, it's not that 1 + 1 = 2, it's 1 + 1 = 4. You get a compounding effect that they're synergistic to each other. And for example, if, Sal will tell you about some of the compounds that are just CB2. Well, some of those CB2 receptor compounds, they don't work so well unless you have a small amount of CB1, THC in it. So it's actually interesting that you need to have a little THC in these kind of
like a catalyst
that seem to potentiate the action of the main ingredient, which is the CB2 drug. And now you compound that one step further with these terpenoids, and these terpenoids all have their own medical effect on the human body. And again now, in medical marijuana, you're getting a blend of all of these things as opposed to a synthesized pharmaceutical drug, which you're making one compound. That one compound is heading to that one receptor. It is not getting the benefits of any synergism from the other potential compounds that could be with it.
I think it's invaluable, this conversation we're having today, because I can just picture when medical marijuana starts happening in New York, which I think is happening next year, correct?
That's correct, January of 2006.
And the different dispensing sites become open. I'm sure, maybe I'm wrong, but I'm sure there's going to be some protesting by people in the community and things like that live around those areas because of the myths and that they have behind this. So it's very, very important that we educate the public of how beneficial this could be with the right patient selection, right?
Yeah, absolutely. Times have changed, though. I would agree 10, 15 years ago about the people being out protesting. It's not happening.
Oh, I hope not.
It's legal now. Medical marijuana is legal in at least 24 states. We expect in the next couple of years there'll be 35 states. The only reason there's still the taboo is that federally it is technically against the law.
Still, federally. Yeah.
Federally, it's a type 1 narcotic, medical marijuana. It is the states that have gone out on their own and seen the light that there's help and hope for the patients that need it, and they're supporting this, but they're not supporting it just openly. They're saying, you know what, we need to have regulations, we need to have education, we need to have rules and restrictions. So each state has come up with their own set of medical guidelines as to what diseases, chronic pain, epilepsy, Parkinson's disease, HIV, which diseases they think are appropriate. And they're doing it in a very responsible manner. What we in the medical community need to do is give them the feedback that they need to more accurately guide their programs, so that, as Sal, I believe, spoke on his last show, Sal was correct. Everybody who's gone on medical marijuana needs to have a toxicology screen. There needs to be an appropriate medical workup. There needs to be the appropriate blood tests, just to make sure that you're not mixing your medical marijuana with somebody who may have an opioid problem, and to also do the appropriate medical workup so that the results that come out can be then attached to as a valid research tool. Because if you don't have all the components and all the variables, you're not really having valid research outcome information. So that's what we're about. We're about teaching the physicians, and we're about being involved with organizations that will help bring an organized research effort to validate and move it forward.
And remember, you're talking about disease processes that have been significantly troubling to physicians to treat. Alzheimer's disease, HIV, nausea and vomiting from chemotherapy. So there's no doubt that the applications are dramatic. And also remember, with all the myths, marijuana was legal up until a not too long ago point. The problem was that it was being used recreationally, and that's where it became an illegal problem. But it was being treated, you go back 2,700 years, it was used as a treatment for spasticity and anxiety and these types of problems. So although there are myths, there's also a lot of history that's involved with using marijuana as a treatment. You said
it's used for Alzheimer's patients too?
That's correct.
Really? And they've shown good effects with it?
Yes, they are. And I actually came across that in my study on the terpenoid and the entourage effect, that medical marijuana seems to help relieve some of the issues associated with Alzheimer's
Dementia?
disease. Yes. But one thing we all have to make clear here, when we're talking about medical marijuana, and we're talking about the medical guided use of marijuana, which is been created for the specific use of treating patients' specific disease entities. None of us here are at all endorsing the use of recreational marijuana. That is not what we're about.
Absolutely.
And we just want to make it very clear here for everybody
Right.
that we're in it for the medical benefits, of our patients.
Absolutely. I mean, those of you in the audience, I'm sure you know that if you take too much of anything, you could die or something bad could happen to you. If you take too much Tylenol, there's no antidote. You die. If you take too many oxycodone pills, you go into respiratory arrest, you die. So you need to take the right amount at the right time for your condition for it to be effective. I think that's what we're saying, correct?
That is correct.
And you know what? Even if you do get some type of withdrawal symptoms, as opposed to something like a narcotic intoxication or even alcohol,
Right.
Most of the time you don't have to go to the hospital for marijuana. You can have some fluids. It's more of a supportive care, rest, maybe something like a Valium or some type of an anti-anxiety medication. Those would be the major side effects if you had any type of withdrawal symptoms. Completely different than someone who's going through an opioid withdrawal, where those patients have to be hospitalized, otherwise they may die.
Right.
So it's a big difference.
Right. And this will all be by prescription, by physicians, before they can even go and get their medical marijuana?
Well, let's be clear, because it is a Class 1 drug, we cannot prescribe, no doctor will ever be able to prescribe until the laws change, medical marijuana.
Really?
It can only be called a recommendation. Prescriptions are technically something that I write on my prescription pad. Sal and I have our prescription pads. We can never, at this point, until the federal government changes it from a Schedule 1 to a Schedule 2, 3, or 4, it can never be a prescription. The states can allow us to make these recommendations based on satisfying the laws of the states, the qualifying conditions, the appropriate workup, the appropriate history, the appropriate screening. Once we have done that, and that we're an established physician for this patient, we can then make a recommendation. We can never make a prescription until the laws change.
But the patient just can't walk into one of these places without that recommendation, correct?
Correct, except in the states where it is currently legal as a recreational drug.
Gotcha.
Which is Colorado.
Gotcha. Have they picked any sites in New York to open up these dispensaries yet?
My understanding on Long Island, there's some controversy. They're trying to open up one out in Peconic. I believe in Manhattan.
I think there's one in Manhattan. I believe there's one upstate.
Yeah,
there should be five.
Yeah, there's 5. And I know Long Island, they're trying to do one out east, and I'm not sure if there's one in Nassau County, but I believe in Manhattan. But they're being worked on.
And I'm sure there's got to be state guidelines or some type of guidelines for these facilities too, right?
Oh, I'm sure
Very
these
strict,
guidelines are very
significant
strict.
guidelines.
Yeah.
And again, as we said, the physicians that even just recommend and not prescribe, but actually recommend, are going to be required to take a 6 or 8 hour CME course, which again is backed by the AMA. We are at this time obtaining accreditation for such a course. We have a significant amount of literature, and hopefully we'll be able to educate the doctors on the specific protocols and the best way to treat their patients.
Are you gentlemen reaching out to docs yet about this, or is that still in the planning stage?
We will reach out just as soon as our formal accreditation is obtained. We hope to be having that in the next few weeks, if not next month or two. And once that is done, we will reach out, and that's what Sal and I would like to do more than anything.
If you have doctors who are watching our show right now who might be interested in contacting you, are you interested in speaking to them now?
Absolutely.
Can you tell them how to contact you?
Sure. You can contact me at my office. My office is 631-351-0295, and I'm in Huntington, New York. Sal?
I spoke earlier, but I am in Woodbury, New York. My office is 516-364-0070.
Yeah, we look forward to working with physicians.
Just in New York or nationwide?
Oh no, we are planning on going nationwide.
Great,
Yeah.
great.
There really is no formal education program that we think is up to the par that we are looking to create. We're looking to do it in hand with the research institutions and with the companies that are the producers, so that we can actually try to put them all together to come out with products that are more efficacious for the disease.
So would it be fair to say, and correct me if I'm wrong, that your gentleman's vision is help the patient, give them something that's not in your armament right now, that is now going to become available, learn from how they respond to what you're giving them, and use that information for further research to refine your product.
Well
No
said.
doubt, exactly.
Is that the goal?
That's the
That is it.
perfect summary of what we're looking
It's a
at.
very valid mission. I
Yeah.
like that.
Thank
With
you.
something that we believe, again, we do believe in.
Right.
And because we're in a situation where we're treating patients that may require that type of treatment with less side effects and more efficacious.
It's a beautiful mission. I like it. Does this help people with arthritis, severe
Yes.
arthritis?
It turns out that arthritis is mediated through what's called cytokines. Cytokines are these inflammatory factors, such as in rheumatoid arthritis, but also in osteoarthritis, that go into the joint and cause breakdown of the cartilage. What is arthritis? A loss of our normal cartilage with associated inflammation of the joint. Well, it turns out that medical marijuana, CB2 receptor drugs, the terpenoids, there are many of these components that have been found to downregulate these cytokines and help people with arthritis. So yes, for us in our practice, we hope to be able to use it
And
someday.
as a matter of fact, there's an agent now, the Sativex that we were talking about, the oral mucosal agent. There's a recent paper that showed that was very effective in treating patients with rheumatoid arthritis who have very severe degenerative changes in their joints.
That's pretty exciting. Pretty exciting. Just rheumatoid and osteo, or all different, psoriatic, all different arthritis?
I believe all types, because psoriatic arthritis and rheumatoid arthritis are both inflammatory mediated arthritides, and they both will go through a cytokine system, so I would imagine that it would be psoriatic and rheumatoid would probably be in a similar class.
So, kind of like what we touched on before, if a patient is on like a biologic for a biologic being like
Humira or
Enbrel,
something like that.
Humira, something
Right.
like that for their condition, can they still take medical marijuana? Or we don't know?
I don't know. We don't know.
That we don't know yet. Again, there hasn't been enough research to
Yeah.
show that. And it would probably be that the medical marijuana may, again, potentiate the other treatment. So it would have to be something that have to be looked at a little more closely.
Very interesting. Very, very interesting. Gentlemen, I want to thank you very much for being on our show, and it was very, very informative. And I think the audience is going to really, really be educated from what they've heard here today, and hopefully make some good, real decisions for their family.
Well, thanks for
Thank
having
you.
us.
Thanks.
So what I'd like to do is I'd like to sum up exactly what our mission is on the Bridge to Health. The Bridge to Health is a bridge that we try to have our patients cross over. And on the way over that bridge, they may encounter different health problems. Not all health problems can be treated by one practitioner. That's why we have specialists in different areas. So what happens is, if you come to our office as a patient, we quarterback you as the patient. We do a full exam, we do a full consultation, and then we make a decision to see what types of treatment are best for you, or what other types of diagnostic tests you need to have done so we can figure out what treatments are best for you or what other providers you need to see. After that's done, we have in our offices a team of professionals that we can walk right up to and say, hey, Dr. Weisberg, what do you think about this x-ray? What do you think about this MRI? What do you think we can do for this patient from a medical aspect? I can walk up to our acupuncturist and say, hey, this patient has these symptoms. Do you think you could check them out to see if you could help them? We can walk up to our pain management doctor and say, well, maybe this patient needs a little pain management right now to get over the spasm, to get over the pain, so we can start to treat them in physical therapy and chiropractic or whatever else they need. And then once they're over that threshold, they might not need the pain medication anymore. But there are cases, unfortunately, where they're going over the bridge. We've tried everything with every professional that we can, and there's nothing else we can do, and they're in terrible chronic pain. The example of this is a good friend of mine and a patient. His name is Gray. Gray was at work, lifted about a 200-pound manhole cover, and felt a pop in his low back. Came into my office. We found an L5-S1 huge disc herniation and extrusion, which totally obliterated, closed out the whole spinal canal. He had to be rushed for emergency surgery. He ended up having a condition called cauda equina syndrome, in which he loses bladder function, bowel function, tremendous pain into his legs. And as a result of that, he went through rehab for about a year. Felt like he was walking on glass every single step he took. That affected his family life, affected his lifestyle, couldn't go out of the house. He became addicted to opioid medication. Very, very, very addicted. So bad that one night, while he was sleeping, he almost died because he almost swallowed into his respiratory tract his vomit that he threw up. He went to rehab, he got detoxed, and still he had the problem. He then went for another surgery. Doctor told him, I think it's the level above it, we can help that. Went to rehab after that. Tremendous pain still. So they just put in a morphine pump into his body. He went through spinal stimulators. He went through all the pain management avenues. They put a morphine pump into his body. That's a little pump that puts morphine into his spinal canal to try to kill the pain that's going down his legs. It was working well in the beginning. It's not working too well right now. So Gray is hoping that medical marijuana might be the answer for him, and it's coming soon in January. These are the types of patients that really need this kind of thing, right, docs?
There's no doubt. Sure. No doubt. It would be very, very helpful.
And if this drug can cause him to walk without pain, be able to go to a baseball game, guess what? Quality of life is extremely, extremely, extremely important. And again, for the select group of patients, the patient with Alzheimer's, whose wife who talks to his wife and forgets what her name is, if this can help him, why not? In the right context, in the right situation, your health is also your mental state. So once again, thank you for joining us on the Bridge to Health. And remember one thing, if what you want is real wealth, join us next time on the Bridge to Health. If you're watching us on Madhousetv, stand by. We'll be right back. If you're watching us on Cablevision, we'll see you next time.
Thanks for watching.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.